Hello, everyone. Thank you so much for joining us today. My name is Marissa Weiss, and I'm a Product Marketing Manager for JOPE's Lymphology. Today's topic is the psychosocial effects of lymphedema and lipedema. This will be presented by Vicki Ralph. Vicki is an occupational therapist, certified lymphedema therapist, and she has a master's in public policy. She has a wealth of experience working in acute care hospitals, rehabilitation hospitals, skilled nursing facilities, and outpatient settings in Wisconsin, Maryland, Washington, D.C., and Colorado. Currently, she works at UC Health and is a closed training instructor. Please note that this is a recorded session, so we will not be taking questions at the end. However, feel free to send me any questions and I will help get them answered. Without further ado, I will pass it over to Vicki.
Hello, and thank you for joining this webinar. I think it's an important topic because we really don't focus or think about the psychosocial impact of lymphedema and lipedema on our lives. And so let's take a look at this, and I'm hoping that this presentation will bring enlightenment and perhaps help you recognize as a patient that perhaps you're not the only one, that maybe some of the thoughts that you've been thinking are shared by many other patients. So let's move forward. And to begin with, let's just look at, well, what is this thing called lymphedema? And really, it's a buildup of extra protein that happens in our tissues. It's kind of like this cells waste that happens, and it just builds up over time, and it creates what we call a protein-rich fluid that's underneath the skin, and it causes this inflammation, and it causes the skin to swell and become hard and have different kinds of changes to it that are just not normal. And it might typically happen in one leg or one arm. Maybe it can happen in the genital region, it might happen on your trunk, it might happen head and neck. It can happen all over the body. But this swelling is a protein-rich swelling. And why that's important for us to know and remember is that sometimes if you go to your primary care doctor who does not understand lymphedema, they might prescribe a diuretic or a water pill that helps try to eliminate that swelling. Well, if you have swelling in just one limb specifically where it has been diagnosed as lymphedema, a diuretic is not going to be helpful over time. If anything, it takes that water out of the limb, but that concentration of protein increases. And so it can actually make things worse over time. Now, I'm not a physician, so I'm not in any way trying to tell you don't take your diuretic, because perhaps you've been given a diuretic for cardiac issues or for more other purposes. But I think this might lead to an important conversation that you might be able to have with your doctor about, should I be on diuretics if I only have swelling in my limb or if I have swelling in my arm? And helpful to share with your doctor that lymphedema is a protein-rich fluid that happens underneath the skin. Now, again, today our topic is on lymphedema, but also lipedema. So let's take a look at, well, what is lipedema? And lipedema, different from lymphedema, is typically symmetrical. Remember, lymphedema was asymmetrical. It only happens on one side of the body or the other. You might get swelling with lymphedema in both legs, but there might be variances. One leg might be bigger than the other, whereas typically with lipedema, the swelling is mostly from the waist down to the ankles. And it primarily affects women, but I have seen it in men. And it's also characterized by a hypersensitivity to touch. So just maybe a light tap to the leg or bumping into the leg can be painful. In addition, typically lipedema patients will bruise easily. That's what hematoma means. It's a bruising that can happen to the tissues. Also, it's interesting, at least in my practice, most of my lipedema patients are very flexible. Someone with this picture that we're seeing here could easily put their hands flat on the ground. And, it's just interesting that that flexibility might be another component that's associated with this lipedema. So when we look at the lymphatic system, we can take a look at the heart. And what happens typically is we have our heart, and we have these blood vessels that come out of the heart called arteries. And they go out to our tissues, they feed and nourish our tissues, and then they pick all the dirty blood, if you will, or the blood that doesn't have as much oxygen in it anymore, is taken back to the heart. Now, that's that closed system that we see this picture of the red, and then the blue is kind of showing your dirtier or your oxygen, your blood that doesn't have the oxygen in it anymore, and it's going back on up to the heart. But we also have a system that goes parallel with the veins, or the blue system that you see in this picture here, called the lymphatic system. And the lymphatic system, how I tell my patients, is kind of like our body's recycling plant, because it picks up all the gunk and debris from our tissues and waste products from our body that we don't want going into the bloodstream. So what it does is it picks stuff up, takes it to these lymph nodes. And lymph nodes are typically, you can find a bunch of them in the gut, behind the knees, in the groin, that bend right between your body and your leg, and in your armpit, in your neck. Many of you may have seen, if you've had a cold or a sore throat or maybe a swollen lymph node happening on the neck. So those are the key areas where you might see lymph nodes. And the purpose of that is that these lymph nodes are little filters, and they clean and they purify things. And then once that fluid is cleaned, and it goes back into the bloodstream up, and it dumps back into the bloodstream above the collarbone. So that's it. Now, I want to just show you a few pictures here. What we're looking at in this first picture, this brown picture here, is a very small section of the lymphatic system. You don't need to remember this is called a lymphangiome. It's just a little tiny system, but you can see how that darker area above it, that's a muscle, and by the muscle pumping, moving against it, you can see the propulsion of the fluid. So I think this is kind of cool to see how the lymph system moves. It's almost like a series of a string of pearls that goes from one to the next and moves through the body. The next picture, this green one, I think this is kind of cool to see, because what we're looking at here is a lower leg and foot. And that dark square that you see in that green picture, that's just electrical tape covering where a trace substance was injected into this ankle. And with night vision goggles, there's some new technology called near-infrared imaging that can show what the lymphatic system looks like and how it works. Typically, it works fairly slowly. But in this next picture, the green picture, I want you to kind of focus on that. There's somebody who's doing manual lymph drainage, this massage that happens with lymphedema, and they're propelling the fluid on up the leg. And you're going to see that in just a second. So watch that green picture right now. Can you see how that fluid just goes on up the leg? It's kind of cool. And as we watch this a little bit, pretty soon you'll see the therapist's hands entering into the picture here. But this might be, if you've had the experience of going to lymphedema therapy and or for lipedema, and the therapist has done perhaps a 45-minute session of manual lymph drainage with you, you might notice that after your treatment session, you really have to go to the bathroom. Well, this kind of help explains it, because all of this fluid is going back into, going way up, dumping in to your bloodstream above your collarbone, and ultimately it goes to the kidneys. And it's important to note that both lymphatic fluid can exit, all this fluid can exit your body via your urine or through your bowel, so both areas. So that's how it can be eliminated from the body. Now, I just want to show in this next picture, you don't have to memorize any of these, but this is just a very tiny little lymph node. But just to show the intricacies of, we've got blood vessels that go to it, we have blood vessels that go away from it, and just the filters that are existing within there, and just the how the fluid is able to, kind of clean things, it filters things, and it moves on out. And lastly, we're looking at a picture of all these little parts of the intestine, where the intestines are responsible for processing the lymph fluid that's consisting of fat, the fats in our body, and it's processed through the gut. So these things they call villi, these little hair-like substances, they clean and purify and help move the fluid along as well. So that's our introduction to the lymphatic system there, but it's important to look at where that lymphedema can happen throughout the body. It can happen in the arms, it can happen in the legs, it can happen in a combination of the arms and legs and genitals. It can happen in little babies. People can be born with it, with something called primary lymphedema, and it can also happen in the head and neck. When we look at lipedema, lipedema can progress from a more mild state, as we see in this left-hand picture. And again, most often lipedema is characterized from swelling from the waist to the ankles. There can be variances that might just be from the waist to the knees, but sometimes you also might have it from the waist to the ankles, but also in the arms. So it can be characterized differently, but today we're just looking at this mild picture here to a more advanced picture that we see on the right here. And again, that symmetrical swelling, and that happens. So that helps, I hope, identify a little bit about lipedema. And it's also important to note that I have seen patients, and there are patients who have a component of, they call lipolymphedema. So it's a combination of lipedema, but over time has also developed a component of lymphedema. So it is possible that someone might have both lipedema and lymphedema. Now, when we look at treating patients and working with people who have this, there are multiple challenges, but I think the number one challenge is that for both of these conditions, it's chronic and it's progressive, and it's important to deal with the lymphedema and the lipedema where you are, because it will continue to advance. But once you're under treatment, once you can monitor it, you can control it, you can monitor it. There's no cure at the moment for this, but at least there are skills that your therapist can teach you to help you monitor, control, and prevent it from advancing, or try to reduce the chances of it advancing to a higher level or worse state. The second challenge, I think, is that, oh my gosh, as a patient, you have so many things and so many questions. And how do you know if you're going to the right therapist? How do you know if you're getting the right treatment? There are so many different options. And, up here we're looking at a picture in that upper left corner. That's a picture of somebody doing what we call manual lymphatic drainage. And what that is you're pushing the fluid out of that affected swollen limb into areas of the body that can absorb the fluid better. And it's a very specific kind of massage that works closer to your body, kind of opens up those vessels, and then progresses on down the limb. It's not one where you start at the foot and you push the fluid up, because that would be almost like pushing on the last car of a traffic jam. You've got to open up the pathways before you keep working on down the limb so that you can open up a place where the fluid can go. This next picture here kind of shows, ideally with good lymphedema therapy, you are looking at 5 essential components. You're looking at this manual lymph drainage. You're looking at good skin and nail care. You're looking at compression. Initially in that first blue section is compression bandaging. And then there's exercise that's involved. But then as we morph into that more independent, what we call CDT, or complete decongestive therapy phase 2, we're looking at getting more independence, that we want our patients to be able to live their lives independently and not rely on their therapist forever and ever. And so in this stage, the patient is taught self-manual lymph drainage, how to self-bandage, how to put on their compression garments, and how to monitor and take care of their skin. But there are a whole bunch of things out there. Look at it. We've got pictures of surgeries that are happening. There's a lot of microsurgeries that are out there. You'll see, recommendations for different kinds of supplements, or perhaps kinesiotape, compression garment. There's just a whole slew of different options, and it can be quite challenging. I think as a patient, you need to see that you should, even after one treatment session, you should be able to notice some benefit. You should be able to perhaps see the swelling has gone down after your therapist has done manual lymph drainage. If you're working with a therapist and you've been working for a week and you have not noticed any improvement, maybe it's the therapy technique. Maybe go and try another therapist. It's always important to take a look that your therapist has these initials after their name, CLT. And that just means a certified lymphedema therapist. Now, if they have CLT-LANA, L-A-N-A, that means Lymphedema Association of North America. That means that therapist has taken an additional exam to prove that they have a good understanding of the lymphatic system. But it's very important to recognize that you want somebody who has these credentials and perhaps hasn't just read a booklet on lymphedema, because therapists who have CLT after their name, they've gone through a course that's 135 hours of training. So it's a special training on top of their OT or PT credentials to help learn how to appropriately treat patients with lipedema and lymphedema. So when we're looking at lipedema and lymphedema, we can recognize that there is an impact on the patient. And let's take a look in these areas. We've got the physical, the emotional, there's the psychosocial, and the financial aspect. And I'm going to get into all of these in more detail, but I think it's important to take a look at, though, even though a limb has become more swollen, we can't ignore the idea that it really involves the whole patient, and it involves multiple areas that we for the patient. So let's take a look. When someone has lipedema or lymphedema, there are obvious physical impacts, and that would be perhaps it's harder to move, perhaps it's harder to walk or get up from a chair, get in and out of a car. Maybe shoes don't fit right, clothing doesn't fit. There's a higher risk for infection. And if you will, it's almost like you've got a petri dish built in under your skin. Remember how I talked at the very beginning with patients with lymphedema? They have this concentration of protein underneath the tissues. Well, it's like a petri dish. And if you remember, you take yourself back to biology class way back in high school, perhaps, a petri dish is a gelatin-based little dish, and if you spread a little bacteria on it, bacteria and protein just love one another and they thrive. So when you have a limb that has this higher concentration of protein in it, And let's say you get a mosquito bite or you get a scratch or something that injects just a little bit of bacteria under the skin, you are at a higher risk for infection. And so for all patients, it's important to recognize this risk and understand, well, what does that look like if I get an infection? And that oftentimes the infection is called a cellulitis infection. And that's where the skin might be hot to the touch. Maybe you have a fever. Maybe the skin, maybe on that limb, looks like you've got a sunburn of sorts that just keeps growing. And it's always, always important to know that if you ever get those symptoms, to go and seek care immediately, because you want to keep this from progressing and getting into your bloodstream. So always recognize that this is of a component of lymphedema, and if you have a lymphedema, lipedema, you would also be at risk. So just take a note that you might need to see a doctor if you ever get this kind of infection. But also the physical impacts are just impaired abilities to do everyday things. That's what ADL, IADL means. So it would be getting dressed, putting your clothes on, taking a shower, standing at the grocery store, going for a walk, hiking, doing things that we do in an everyday life. Maybe just sitting at your desk all day increases the legs as well. So it can have a huge impact on the physical component. But let's also take a look at the emotional impacts. I mean, have you ever felt that stress of just being different? Why, do you have a leg that's larger than the other, or your arm is larger than the other, and you haven't maybe seen other people who have had this? Or is it frustrating that perhaps your doctor doesn't seem to understand what this is about? And sadly, with little kids, and as I said at the beginning, some little kids are born, babies can be born with lymphedema. We call that a primary lymphedema. And kids can be brutal, and the teasing and bullying that might happen because of that can have a long-term effect on a person. The physical appearance perhaps has changed, and that's hard. Just facing the idea that this is a chronic condition that they have to manage, that you may have to manage for a long time. And I say they because I'm not sure if you might be listening for a loved one who has lymphedema and lipedema, but just recognizing that it can be a chronic condition. And just the added chores that, in order to keep the swelling down, to manage the swelling, there are skills that you'll be learning from your lymphedema therapist that adds to your daily routine. It adds time onto your day. And all of us are stressed. We all have busy jobs. And so just to add one more thing sometimes can be quite a burden. The psychosocial impact, that mobility impairments can, perhaps it just might be difficult to get around, so it might limit you from wanting to socialize with others. And again, that just frustration of other people not understanding and trying to explain it to everybody. Maybe there's some embarrassment, and maybe it's just discomfort, just the discomfort that you might have from sitting or standing too long. Can also affect your ability to socialize with your friends. I think sometimes when facing lipedema and lymphedema and recognizing the chronic condition, I think it's important to take a look that there are stages of grief. And I'm sure many of you have all heard of this before, but there are when we're trying to deal with something that's difficult, for whatever reason in our lives, there are often different stages that we go through. And in the first stage is something called denial and isolation. And you might have, just seen, well, this can't happen to me. This isn't going to happen. So yes, they've taken lymph nodes out of my arm, and yes, I've had breast cancer, but I'm going to beat the odds. It's not going to happen to me, kind of the idea. But then number two, it can be angry. I mean, many of my patients who've had cancer and have had lymph nodes taken out are angry because they never really fully grasp the concept that they had lymph nodes taken out and that this lymphedema could possibly happen. And they didn't understand that, and so that's difficult. Maybe bargaining, if only I had done this, if only I had done that. There's just a whole kind of a mental exercise that we do with ourselves, just to kind of torture ourselves, if you will, and it's kind of frustrating, but it is a component of this grieving process. And there might be a mild depression that people go through, just the frustration of, really, I have to deal with this, and this is something that is going to be with me forever. It can be quite a lot to take in. And lastly is the acceptance. And this is a stage that's really wonderful as a therapist when I see my patients reach this point. And sometimes that's when they recognize, yeah, it stinks. I have this condition, but it is as I am who I am, and at least I'm alive, and at least I've got other joy in my life, but not all patients reach this acceptance, but it is a joy as a therapist to see when my patients get to that stage. So let me share with you a video that I made with close training. I'm an instructor for close training, and so we made this video of my patients, and I wanted to capture for you the emotional impact of what it's like to have lymphedema and when you are a patient. So let's take a look.
So I first noticed the swelling of my leg back in June of 2011, and it's been ever since a struggle. I was working in the bank, and sometimes I would kick off my shoes closer to the end of the day, and I wasn't able to put my shoe back on.
One day I noticed that I had some swelling in both my ankles, and I had a really tough time putting on, I had some knee-high boots, and I had a tough time putting them on, and I got a little nervous.
I got lymphedema about a year after surgery. It just started getting bigger. I was working outside and doing yard work and things like that, and it just started getting bigger and bigger and bigger, and I didn't quite understand what was going on. Initially, I didn't have problems with lymphedema. I believe that the trauma from the mammogram is what flared the lymphedema. I had the mammogram in the morning, and by that afternoon, I knew something was wrong with my right arm.
I was 10 years old. I had spent the night at my grandparents' house, and my grandmother and I had gone shopping, and later that night we got home. My mom took off my shoes and noticed the indentations in my sandals. I never even thought to mention lymphedema, to be honest. I didn't know it was genetic. And so growing up, it was one of those things where my brother had it. My brother was born with it. My brother always said, I'm just lucky it's me and not you. So,
yes, that was the start of it. Called the doctor, and gave her the diagnosis of lymphedema precox. So there was no cure. I just had to look at the labels. You have lymphedema, and I can't do anything about it. And that was it.
I cried. Seeing what my brother went through made it really tough. And I knew that there was no cure for it.
It was about, 2 or 3 years of you can't swim, you can't run, you can't do this, you can't do that. And they would have me wear braces on my legs, and the kids would go, oh, look, she's got one sock on. I had no explanation, and it was hard. I think initially I was afraid to do things. It was hotter than blazes outside that summer, and you're going, I can't go outside, I can't do anything, my arm's all wrapped up. Well, it's more of an ache in wrist and hand area, lower forearm. Gets achy, feels full, stiff, kind of heavy. I'm right-handed, it's in my right arm. You're stuck. You're just stuck.
It's not only a physical aspect of it. It's, I think, more psychological and mental. It's just, you do your best to deal with it, and you can't. It's just, there's so much.
At first, when I first found out, I was angry. I was more than a little angry. It's like I could go and kill somebody because nobody says anything. I'm furious.
When I'd gone through my operation with a cervical cancer, and like year after year, and they kept telling me that you're okay, it's not there, and at 5-year mark, it's great, it's done, it's gone. I'm done with it. It's, it's gone. And then 5 years down the road, this showed up, and it's not going anywhere.
You go through chemo, you have the surgery, you have the radiation, you think, okay, now I've got 5 years ahead of me to make sure that I'm cancer-free before they actually say it. Now, a year after surgery, I've got this. I was mad, I was angry, I was frustrated, I was pissed off. You think you're home free, and you're not.
I'm not supposed to be there. And then all of a sudden you feel like a sausage squeezed into this outer layer, and your shoes don't fit, your clothes doesn't fit. You wake up in the morning and you're like, it's so fat. Bigger than the right one. And it's like, why?
As a woman, I loved wearing shorts and dresses and, cute shoes, and so that, all of that kind of was like, oh my God, I didn't realize how much my life was going to change. The hardest part is buying pants, because I'm a jeans and t-shirt kind of girl, and finding the pant legs that fit around my leg.
Suddenly nothing fits. That's the biggest issue for me, is that you're stuck with going out and purchasing items that are much too large for you. It's big enough for your arm, but the rest of you doesn't fit.
And I couldn't wear the shoes that I wanted to wear. And I felt uncomfortable being in a bathing suit. And I couldn't wear shorts anymore. And there were certain things that, because I'm now wearing this stocking every day, I had to change kind of my wardrobe and the look. And so it made it even more difficult. And I looked back at pictures from a year ago, and that it just made me really sad.
I think that I feel very self-conscious, especially during the summer, because I wear shorts. If I wear shorts and people are looking at me funny,
I notice people staring. A lot of people ask, what did you do to your arm?
you ended up covering yourself as much as you can. Because you don't want people to know. Nobody's going to come up and tell you anything, but you can see the look and the wonder and the whispers.
And sometimes they ask questions about it, depending on what kind of mood I'm in that day. Reflects on my answer to them.
You meet all different kinds of people. They either say, oh, what's wrong? Or they say, wow, what's your leg? Oh my God. I need to have a COVID visit. I'm going to my shoes. Oh, that's so gross. Don't do that.
Like, how do you explain it? Because you don't want to get too technical, yet you don't want to, like, in the beginning, I literally would say, oh, it's nothing.
Every day it's a battle. It hasn't been a day where it's easy. It's every morning, it's a chore. What to wear to camouflage the flaw that I have. The fact that everybody thinks you can fix it, despite what you eat, what you
surgery, what you do. It bothers me because people are like, oh my gosh, your leg is so fat. Why don't you go do acupuncture? Why don't you go do, what are you eating? It doesn't affect it that way.
I know that it's not going to go away. It's not curable. It's for the rest of my life. And honestly, there's kind of like, it's a sad thing that there's really no hope to get rid of it.
And it's just really hard that people think that there's a quick fix for it. There isn't a quick fix for it. It's something you have to live with every day of your life.
I have kids. I have a 3.5-year-old and a 4-month-old, and even this past summer when I was pregnant, I had to really think about my kid, and I wanted him to be proud of me and not embarrassed. That I said numerous times to Vicki and every single member of my family that I want my leg to be cut off, because when I have a wooden leg, I can put it in the corner and touch it or detach it. It's not going to change the size.
It's horrible. It's an absolute depressing. I can't even describe how awful it is, because you want to be over this, and it's not. This is here forever.
It stinks back to think about all that stuff, but it sucks.
Yeah. No, I still have my high heel shoes, but I can only look at them now. Maybe I'll put one on the right foot and walk around the house. That's it. It doesn't go on the left foot. I feel like a Cinderella, but she got her crystal shoe. My crystal shoe doesn't fit.
Oof, that's such a powerful video, and I want to just say all these patients, given the opportunity to share their story about lymphedema, opened up a flood of emotions. And these are patients who are normal functioning individuals. They are not chronically depressed or anything, but given the option or opportunity to just share, you could just see the emotional impact that their condition has had on them. And again, just thanks to Close Training. Close Training is a company that I teach for, and we teach lymphedema courses around the country, and they just have a wonderful ability to put together these wonderful videos that I'm going to share a couple more with you this morning. So let's move on to take a look at, I think all of you may have seen just the financial impacts. True lymphedema requires what we call flat knit garments, custom-made garments that are essential to maintaining or keeping the swelling from getting any worse. And daytime garments are very expensive, and they only last about 4 to 6 months, and they need to be replaced. Nighttime garments, they might be able to last a year, but they can be expensive. If you're fortunate enough, you've seen maybe your insurance will cover it, but not all insurances cover lymphedema garments, and so that's just on an individual basis of what is covered, what is not covered. So let's take a look at what my patients have to say about the financial impacts.
It's expensive. It's expensive. It's definitely a treat. This is where all my money goes now, pretty much, instead of having the fun little things like have my hair done and go out with my girlfriends. I have to make sure that I have finances for my garments.
It's constantly buying new wraps, and it gets expensive. It gets very expensive.
They do cover the visits, most of it, but I do have to pay a copay for each time.
It's pretty much all out of pocket. I have to think about that. But,
yeah, the insurance doesn't cover any of it. So it's been definitely a big penny.
They only cover so much for insurance. then you have to stop. And by the time you stop, you know, is the insurance going to cover it the following year or the next year or the next year? And they may not. It kind of had to do with timing because it was a deductible. So if I have had to pay for a few of the garments just because I needed it before the deductible was met.
Now, if I went into the hospital for a heavy-duty infection, well, my insurance covered that pretty well to keep from getting that infection.
And they do cover the visits to emergency room for thousands of dollars with the cellulitis condition, but they will not cover a couple $100 for a compression custom-made garment.
Not something I enjoy, shelling out that kind of money. And it does bother me that the insurance won't cover something that will keep you from really serious problems.
Whatever it is, the answer is that we do not cover the lower extremity custom garments.
The insurance company told me that because I do not have breast cancer, I'm not a candidate.
It's not a reason just because I have a lymphedema in my leg and not in my arm. How can you divide me, upper half and a lower half, say I'm going to cover the upper half, but I'm not going to cover the lower half of your body?
I mean, I had someone tell me, well, unfortunately, you don't have cancer, so we can't help you. And to that, I literally said to the woman, did you hear what you just said?
But because mine's primary, I don't have cancer, which is good, but doesn't do any good to be covered by the insurance company.
But it's going to be what it is, right? Because you need the garment.
Yeah. I mean, you live with it. I mean, you have to live with it.
That's unfair. That's unhuman.
So that's taking a look at the emotional and then the financial impact that can all have an effect on just the whole total frustration that one can have with having lymphedema and lipedema. Let's take a look at when someone has gone through good treatment, what kind of outcome, and let's take a positive spin on here. Here's a patient who had a swollen limb on the upper left. You can see the left arm is much more swollen than the right. And CDT stands for complete decongestive therapy. That's good therapy where you go in almost daily, so maybe 4 or 5 times a week. You go in and your therapist will do a massage followed by moisturizing your limb and putting specific bandages on that limb. And from this first picture to the next picture 3 weeks later, you can see a dramatic change that can happen with good, complete decongestive therapy. Sometimes a therapist might just do therapy once a week, and for someone like this, it's not going to be effective. If anything, it's almost a waste of healthcare dollars because you do the massage, you put the bandage on, but if that bandage falls off and you have several days before you have your next treatment session, then you're going to swell right back up. And so really, as a patient, know that good therapy, when you have an intense, when you're first starting out with your lymphedema therapy, you want to seek something called CDT, complete decongestive therapy, where you're seen almost every day for about 3 weeks to really bring that swelling down. Let's take a look at some other patients who've gone through CDT, complete decongestive therapy. Here we have one picture there, and then after therapy. So you get this dramatic effect, a huge benefit by being seen every day for about 3 weeks. Let's take a look. Here's another picture before and after, before and after. And you can just see here, wow, what a benefit it is once you get that swelling down, how much easier it is to move, to get in and out of the car, to wear clothing. All of those things can help a person's overall well-being. Here's a patient before therapy, and this one was about 5 weeks later. And then lastly, we've got a very dramatic patient who had swelling, and this was not my patient. This patient, my understanding, was slated to have an amputation of this leg and was referred to a lymphedema clinic, and 4 months later, we've progressed from there to there. So dramatic effects that can happen with good lymphedema therapy. So what I want you to take home today is just understand that lymphedema, with lymphedema, the physical, the emotional, the psychosocial, and economic burdens on all of you as patients, really, I think, is largely underestimated. Many times people can see that physical component, but to recognize the emotional, the psychosocial, and the economic burden that you're facing is important, and just to know that it's real, and that as a patient you're not alone, that this is something that all patients are experiencing. I've got a couple more videos that I'd like to share with you, and I think this one here brings it all together. So let's take a look at looking at these patients.
Hi there. Hi. Hi.
It all started when I was diagnosed with breast cancer in August 2012. I immediately went into chemotherapy that was followed by surgery and then radiation.
About 23 years ago, I developed a blood clot in both legs that completely obstructed the saphenous veins bilaterally, and I also had a DVT. The swelling never went away in one of my legs. I do think there was probably issues that started well before then, but when I was 23 is when I noticed some serious problems.
I had 2 cancer treatments, and the second one is when they took out a bunch of lymph nodes, and after that time I was starting to get minor swelling in the leg, and at that time nobody really knew what was causing us, I guess.
Through high school, or even preteen, I always carried a bit more weight than my sister. I have a fraternal twin sister. She was extremely thin, so there was that always constant comparison.
Well, I had a bilateral mastectomy in 2013, and they took 3 sentinel lymph nodes from my right side where the cancer was, and 10 from the left side, which had no cancer.
It was 1982. I was in high school, and it suddenly just started, the right leg started swelling first, and I didn't know why.
It all began with being diagnosed with metastatic melanoma, which is the primary reason why I was seeing doctors.
Yes, so I was diagnosed in 2014, but really started seeking my first help when I was 13, so it'd be 29 years ago.
I decided to become a spokesperson for Learn because I developed lymphedema after my double mastectomy. And prior to that, I knew someone who had lymphedema in their left arm. And I saw the effects of lymphedema when it's untreated. So I thought that lymphedema meant having a swollen arm with oozing skin, and it scared the hell out of me.
I think this is so true. What Kathy Bates was talking about, she's a spokesperson for a company for the for learn, she mentioned, and that means if you go online, you can look at LE and the and sign RN. And what that stands for is the Lymphatic Education and Research Network. They have a wealth of information, resources for patients. And to help you understand lymphedema, they have information to even 10 points that I want my doctor to understand about lymphedema or lipedema. And so just know that there are wonderful resources out there for you, for patients. But if any of you have not heard what LEARN is, that's the LE, the ampersand RN. So now let's take a look here. As therapists, our goal is for all of you patients to be as independent as possible in your daily management of lymphedema and lipedema, and just based on what your own functional and cognitive abilities are, and we just really want the best for you. And my hope for all of you is that you do find a good therapist out there, that you find a therapist who is a certified lymphedema therapist who can help you keep your leg or arm or body part, the swelling down to its lowest level, and help get you fitted for appropriate garments. And recognize that most of you, if you have true lymphedema and lipedema, oftentimes this will require a custom-made garment, not an off-the-shelf garment that cuts in and can cause damage and break your skin. So just hopefully you will all find a good therapist out there, and that today's talk has been helpful in just recognizing that there are the physical, the emotional, financial impacts of lipedema and lymphedema. So thank you for your attention, and I hope today's talk has been helpful.